All right, you guys, welcome back to all my listeners. This is episode 11 in season 16. Today is Wednesday, November 12th, 2025. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys, I hope everyone is doing all right this second week of November. There's been a lot of crazy weather changes here in the Midwest. We just received our very first snowfall. Yes, it was a light dusting, just around 1.5 inches, but we just received that on Monday on top of our fall leaves. So very interesting when we get that sort of early snowfall, and the golden yellows and oranges and reds are still there as well. And the grass is still quite green. But nonetheless, we did have a dusting of snow. But anyways, there's, I'm sure, more to come in the winter season. But that is what is going on here in the Midwest. But anyways, you guys, it is the second Wednesday of the month, and you know what that means. It is going to be my Newsworthy feature for the OIG Work Plan updates for the month of October 2025. And in my trusty tip, I'm just going to go ahead and quickly focus on yet another claims processing update from CMS, this time on telehealth claims. And of course, I'm going to go ahead and close out and round out today's episode with another remarkable quote on resilience by Ernest Hemingway. All right, you guys, let's get into it. So in today's Newsworthy, the month of October's OIG Work Plan updates. Now, there are a total of 8 updates made to the OIG Work Plan for the month of October 2025. The first update is titled, Using Targeted Reviews to Reduce Fraud, Waste, and Abuse in Medicaid Non-Emergency Medical Transportation. Now, this report is expected from the Office of Evaluation and Inspections. Medicaid covers non-emergency medical transportation for eligible enrollees, allowing them to travel to doctor's offices, hospitals, or other settings where Medicaid-approved services are provided. However, transportation services can pose a significant risk of fraud, waste, and abuse in Medicaid. Past OIG work has identified significant vulnerabilities in state and federal efforts to reduce fraud, waste, and abuse involving non-emergency medical transportation in Medicaid. This report will use key indicators concerning billing to conduct a targeted review of non-emergency medical transportation services. It will determine the extent to which these services did not meet Medicaid requirements and will identify the amount that could be saved by using indicators to target reviews of non-emergency medical transportation services. Now, this final report is expected in fiscal year 2027. The second OIG Work Plan update made for the month of October 2025 is titled Identifying 340B Units to Recoup Inflation Rebates for Part B Drugs in Medicare Advantage. Now, this report is expected from the Office of Evaluation and Inspections. To help address rising costs, the Inflation Reduction Act requires drug manufacturers to pay rebates when the price of an eligible Part B drug rises faster than inflation. While CMS began implementing this program in Medicare fee-for-service, it has not done so in Medicare Advantage, or MA, citing, quote, operational considerations, end quote. Such considerations may include difficulties when using the MA encounter data to identify which units of Part B drugs were purchased at a 340B discount price. Cost savings from inflation rebates for Part B drugs furnished in MA could be significant, especially considering that MA accounts for the majority of Medicare enrollment. This evaluation will determine the extent to which MA companies collect, store, and report 340B information on Part B drugs furnished in MA. Further, the OIG will estimate the potential cost savings of recouping inflation rebates on eligible Part B drugs furnished in MA. Now, this final report is expected in fiscal year 2027. The third OIG Work Plan update made for the month of October 2025 is titled Medicaid Managed Care Behavioral Health Screening for New Adult Enrollees. Now, this report is expected from the Office of Audit Services. State Medicaid programs contract with managed care organizations, MCOs, to provide healthcare services to enrollees. Federal regulations require MCOs to make a best effort to conduct an initial screening of each new enrollee's needs within 90 days of the effective date of enrollment. OIG will review selected state Medicaid agencies and their MCOs' efforts to screen new adult enrollees' needs for behavioral health services. Now, this final report is expected in fiscal year 2026. Now, the fourth OIG Work Plan update made for the month of October 2025 is titled Potential Cost Savings for the Medicaid Program if States Adopted a Minimum Medical Loss Ratio and Required Remittances for Managed Care Organizations. Now, this report is expected from the Office of Audit Services. Most Medicaid enrollees receive healthcare services through managed care delivery arrangements, where states pay managed care organizations, or MCOs, a monthly capitation payment for each Medicaid enrollee. The Centers for Medicare and Medicaid Services reviews and approves capitation rates that are actuarially sound and developed in a way that MCOs could reasonably achieve a medical loss ratio, MLR, of at least 85%. The MLR is a measure of the proportion of premium revenue spent on enrollee healthcare services or quality improvement activities compared to health plan administrative costs and profits. Federal managed care regulations give states the option to set a minimum MLR of at least 85% and require MCOs to submit remittances to the state if a Medicaid managed care plan fails to meet the minimum MLR. However, not all states have a minimum MLR requirement or require remittances when MCOs do not meet the state set minimum MLR. OIG plans to identify potential cost savings for the Medicaid program in states that do not have a minimum MLR requirement or require remittances from MCOs when the state set minimum MLR is not met. Now, this final report is expected in fiscal year 2027. Now, the fifth OIG Work Plan update made for the month of October 2025 is titled Comparison of Average Sales Prices and Average Manufacturer Prices Results for the Third Quarter of 2025. Now, this report is expected from the Office of Evaluation and Inspections. When Congress established average sales price, or ASP, as the basis for Medicare Part B drug reimbursement, it also provided a mechanism for monitoring market prices and limiting potentially excessive Medicare payment amounts. Now, Section 1847A D1 through 3 of the Social Security Act mandates that OIG compare ASPs with average manufacturer prices, AMPs, and widely available market prices, WAMPs, if any. Now, if the OIG finds that the ASP for a drug exceeds the AMP by 5% in the 2 previous quarters or 3 of the previous 4 quarters, the Secretary of Health and Human Services may substitute the reimbursement amount with a lower calculated rate. This quarterly memo summarizes the results of OIG's comparison analysis based on ASP and AMP data reported for the second quarter of 2025. The memo specifically reports the number of drugs the OIG identified that met the criteria for substitution of a lower reimbursement amount. Now, this final report is expected in fiscal year 2026. Now, the sixth OIG Work Plan update made for the month of October 2025 is titled Comparison of Average Sales Prices and Average Manufacturer Prices Results for the Second Quarter of 2025. Now, this report is coming from the Office of Evaluation and Inspections. This quarterly memo summarizes the results of OIG's comparison analysis based on ASP and AMP data reported for the second quarter of 2025. The memo specifically reports the number of drugs the OIG identified that met the criteria for substitution of a lower reimbursement amount. Now, this final report is also expected in fiscal year 2026. Now, the seventh OIG Work Plan update made for the month of October 2025 is titled Comparison of Average Sales Prices and Average Manufacturer Prices Results for the Fourth Quarter of 2025. Now, this report is expected from the Office of Evaluation and Inspections. This quarterly memo summarizes the results of the OIG's comparison analysis based on ASP and AMP data reported for the fourth quarter of 2025. The memo specifically reports the number of drugs the OIG identified that met the criteria for substitution of a lower reimbursement amount. This final report is also expected in fiscal year 2026. And the eighth and final OIG Work Plan update made for the month of October 2025 is titled Comparison of Average Sales Prices and Average Manufacturer Prices Results for the First Quarter of 2026. Now, this report is expected from the Office of Evaluation and Inspections. This quarterly memo summarizes the results of the OIG's comparison analysis based on ASP and AMP data reported for the first quarter of 2026. The memo specifically reports the number of drugs the OIG identified that met the criteria for substitution of a lower reimbursement amount. Now, this final report is expected also in fiscal year 2026. And now it's time for my best practice tips in Trusty Tip. Now, just a very quick update on a recent MLN Connect special edition newsletter for Friday, November 7th, 2025. So just last week. They provided a special edition update on the processing of telehealth and acute hospital care at home claims. So lots of claims processing updates, right? Ever since the government had shut down October 1st, there was another update made that I talked about on October 21st at a webinar that I had delivered. And now this very last one that they just provided on November 7th. So I just wanted to read that for my audience to make sure that they know what to do with their telehealth claims as well as their acute hospital care at home claims. Now, the special newsletter edition states, quote, in the absence of congressional action beginning October 1st, 2025, many of the statutory limitations on payment for Medicare telehealth services that were, in response to the COVID-19 public health emergency, lifted and subsequently extended through legislation again took effect. These statutory limitations include restrictions on payment for many telehealth services provided to beneficiaries in their homes and outside of rural areas, and the provision of hospice recertifications that require a face-to-face encounter via telehealth. These limitations are not applicable to all Medicare telehealth services, such as those for behavioral and mental health services, those for monthly ESRD-related clinical assessments, and those provided by applicable Medicare Shared Savings Program Accountable Care Organizations, ACO, participants. CMS has been continuously evaluating their operations since October 1st, 2025, and taking action when operationally feasible. So to date, to ensure that CMS pays only telehealth claims consistent with current law, CMS has instructed the Medicare Administrative Contractors, the MACs, to pay telehealth claims with dates of service on and after October 1st, 2025, when CMS can definitively confirm that the claims are for behavioral and mental health services or otherwise meet the requirements described at Section 1834M of the Social Security Act. Now, CMS has identified these claims using the list of HCPCS codes identified in Table 1. And when you take the time to review Table 1, there is a laundry list of approved telehealth CPT codes as well as HCPCS codes. Now, additionally, CMS has instructed the MACs to process Medicare telehealth claims with a place of service code 10, which is for the patient's home, that contains a diagnosis code in the F01.A0 through F99 range if the services were not performed by physical therapists, occupational therapists, speech language pathologists, or audiologists. CMS has further released a small batch of other telehealth claims that they can identify should be permissible to pay under current law. However, due to systems limitations and recognizing that not all telehealth claims for behavioral and mental health services necessarily include a diagnosis code in the above range, that F01.A0 through F99, now specifically those codes are for vascular dementia through mental disorder not otherwise specified. So take the time to make sure you review those codes in your ICD-10 CM code books. Let me continue. However, due to systems limitations and recognizing that not all telehealth claims for behavioral and mental health services necessarily include these diagnosis codes, often to further protect the privacy of the patient, CMS has not been able to identify all claims that are payable under current law. These limitations have also impacted their ability to identify telehealth services performed by clinicians in applicable Medicare Shared Savings Program, ACOs, who may receive payment for covered telehealth services to certain Medicare beneficiaries without geographic restrictions, including in the beneficiary's home, per Section 1899(1) of the Social Security Act, and as added by the Bipartisan Budget Act of 2018. Now, to date, this subset of telehealth claims, including those submitted by clinicians in applicable ACOs and those that CMS is not able to identify as for behavioral and mental health services, has been held. Now, to resolve this subset of claims and improve cash flow for practitioners, CMS is taking further action. For the subset of telehealth claims that are currently being held and that were submitted on or before November 10th, 2025, with dates of service on or after October 1st, 2025, CMS will be returning those claims to providers. Now, for professional claims, claims will be returned with the following messages on remittance advices, CARC 16 and RARC M77. Practitioners may resubmit returned claims that meet the statutory requirements. End quote. And finally, I focus season 16 Spark on resilience. I want this 16th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires us with their insights on resilience. So in this week's inspiring quote in Spark is from Ernest Hemingway. The world breaks everyone, and afterward, many are strong at the broken places. So very true, right? I love this quote on resilience. You are capable of more than you know. Remember all those times life knocked you down. You found your own way to get back up. You are stronger because of all your broken moments. Those broken moments gave rise to the very best you. I'm happy Ernest Hemingway's spark still burns brightly and continues to inspire so very many. All right, you guys, that wraps up today's episode. So I hope you guys are looking forward to whatever your plans are in the next weekend. Hopefully you are making plans and recipes and gathering families together. I know Thanksgiving is at the end of this month. Hopefully you have some travel plans, driving. I don't know about air travel, really. Things are being canceled left, right, and center. So hopefully you can drive to your gatherings and have a good time with family and friends. All right, you guys, but thank you so much for listening on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.